So again, with the Aboriginal Community Controlled Health Services, it's not just around actually having a health service for the community where they can actually go to. There are a lot of other values of being an Aboriginal Community Controlled Health Service. The fact that employment, you'll often find that it is a priority, or there may even be Aboriginal identified positions such as Aboriginal health workers. Many CEO positions are Aboriginal identified. So it's great employment opportunities for Aboriginal people to actually think about getting into the health field themselves. The education of staff. A lot of Aboriginal Community Controlled Health Services really pride themselves on their professional development, their in-services. In my role as the Workforce Policy Officer, it's my priority to try, particularly with the Aboriginal health worker profession, to help map out career pathways, whether it's to stay as an Aboriginal health worker and build themselves within their capacity as an Aboriginal health worker, or to actually look at other career pathways such as nursing or medicine. Engagement, empowerment, social action. This again is all about that ownership, all about empowering the individuals and the community to take control of their health. These are some of the important terms that we tend to use within the Aboriginal Community Controlled Health sector. Obviously the first one is Aboriginal Community Control. Holistic health, which I've mentioned a couple of times, not just about the physical well-being but the social and emotional needs as well. Self-determination, the ability for people to take on their own political, economic, social and cultural development with building improvement within health as well as their social needs. Cultural respect, cultural safety, cultural security. You hear a lot of it, you hear a lot of terms, cultural awareness, all of these aspects. There are different terminologies around each and every one of them, similar but different. So it's important that when you hear cultural awareness or cultural security or cultural safety, to think about what context it's being utilised in and why that term has been used. There are a few workshops or training around different levels of training, such as cultural security or cultural safety. In a sense, it's a little bit of different levels. Cultural awareness is just being culturally aware. Cultural safety is about understanding cultural needs in much more of a where you're actually working to make it a culturally safe environment. And culturally secure is probably one of the higher levels of being more intricately aware and trained within cultural aspects. Leadership. Now AMSANT actually have a leadership program. We feel leadership is one of the most important things within our sector. It is something that our CEOs, it has one of the most important qualities in to be able to lead the organisation through tough times, through growing and nurturing the health service. The thing that we're finding though is that we're needing more Aboriginal people to step up within the Aboriginal Community Controlled Health Service. So we've started up a leadership program which has been going since 2006. Now the whole aspect of the leadership program is to not just get people to think about being CEOs or managers. It's actually about getting them to think outside the square of and building their confidence up of what they can do. We believe that people are already leaders within their community and within their families. We're wanting them to think about broadening that scope and becoming leaders within the health service, to think about where they want to be in 10, 20 years' time. For me, it's nerve-wracking standing up here. 5 years ago, there's no way you would have got me up here. But these are the things around the leadership program. I've done all of them actually, but now to the point where I'm actually coordinating them. Because I believe in such a program, because for me, just simply getting up and even introducing myself, saying my name and where I come from, was very, very hard. And it's a common thing basically. So our leadership program builds the capacity of people to build their confidence, to be able to get up, to speak, to be able to think just outside of their health service or their community, to show that there are a number of people across the Northern Territory, even nationally, that want to have the ability to be able to get up and speak, that want to be able to advocate and lobby for their community and for their health service. And we've had a number of success stories of people just getting up and speaking, just even talking to the media, getting onto networks, just coming out of their shell. It's amazing just the little things of detail that you pay attention to, how it can really make someone blossom without them even realising they had the potential to. And partnership. We're all about partnership within the sector, and that's why it's so important for AMSANT to have partnerships such as with NTGP, with our health services, with NT Medicare Local, Department of Health, because without those partnerships, we're all going to be doing different things. We're all going to be doing the same things in different ways, not all the best ways, but if we work together and bring in our skills, bring in our knowledge, and work together and put our resources in together, we've got more of a chance of actually gaining ahead with achieving what we want to achieve.